You're listening to C103's Cork Today podcast. Phone and text lines are currently closed.
Off to the Health Hub, Times Square in Ballincollig, where I'm joined by Anneliese Dressel. Good afternoon to you, Anneliese.
Good afternoon, Patricia.
And you are very welcome. Let's get straight in with questions. This came in earlier. Question for Anneliese, please. I've got arthritis in my fingers and hip. Anneliese mentioned a while back a product called Perniton. So I purchased it. While I'm getting great relief in my fingers, I'm not getting the same relief in my hip. Is there anything else she would recommend? Happy New Year to you all. Many happy returns. So it's working on the arthritis in the fingers, but not on the hip.
On the hip. So you see, I suppose the Perniton is actually a cream and it heats up and you get great relief from that heat. Now it doesn't, I don't think, have a long-term benefit. Personally, I use it a lot, but I don't feel it fixes the problem long-term. And I suppose with the fingers, it's getting into the joint much easier. The hip joint is much further buried in, so it's probably not getting in to give any type of relief. So I really think you need to actually take something internally to start working on the hip, to start bringing down the inflammation and supporting the cartilage formation in the joint. So I would recommend the ones that we really get good feedback on here. There's two of them. The first one is by One Nutrition, an Irish company, and it is called Joint Support. And we get great feedback on that. I had one lady who came in and even showed me how she could touch her toes within the space of a month, having taken it for a month. So sometimes that works brilliantly. The other one that we get good feedback on is the GAL UC2 cartilage. And that works very well as well, particularly for people who've got the autoimmune conditions of rheumatoid arthritis. It seems to work better for those people. So that's UC2 cartilage. It's a type 2 cartilage. And then she could take a natural anti-inflammatory on top of that if you still weren't getting the benefit. And that would be something like curcumin, which is the extract of turmeric, or boswellia. And you'll get lots of different brands of those in any health shop. But I would start probably on the joint support and see how you're doing after 6 weeks to 8 weeks. And if you're feeling the benefit, fantastic. If not, add the anti-inflammatory.
Kate is looking for recommendations for a supplement for hair thinning that she says is due to the menopause.
Okay, so normally I would say that you always go to the root of the problem. So in this case, I'd be saying support yourself for menopause. And I think that's a great way to do it because it also is really good for your bones, for your skin, for your libido and your mood, your lust for life, all of that. So you can take natural menopause plant-based HRT. But when it comes to hair, I think you should also take a hair supplement. And the ones that work the best, and I'd say for hormonal thinning, is the Norcrin. And we see good results with this in the shop. It's quite expensive. It's spelled Nourkrin. And if your hair is actually thinning on your scalp, so if it's basically falling out and not growing back, that's the one that you want because it can kickstart those dormant hairs back into regrowth again. Now, if it's just the quality of the hair, so it's still growing on your scalp gland, but it just feels thin and limp, then the biotin is the best. And you want about 5,000 micrograms of that, which is a fairly high dose. So we have it here, I think Solgar do it. Oh, actually, Maconta, an Irish company, they do a lovely biotin as well. And we also have gummies of the 5,000 milligrams. So make sure you get the high dose. And the biotin isn't that expensive, so if you want to cover all of your bases, do both.
Okay, someone says, Liz says, hi Anneliese, I have floaters in my eyes. Is there anything I can do from a natural point of view to get rid of them?
That's a difficult one now, really, Patricia. I suppose floaters can be for a number of different reasons. There'd be a few questions I need to ask, like, are they there all the time? Is it more when you get up? Are they kind of blacky silvery? Or is it like a kind of a speck in your eye all the time? So sometimes you get those kind of floaters. It could be maybe down to a dizziness, blood pressure thing. And then sometimes there is an issue with the eye itself. So if it's the blood pressure one, maybe take something like magnesium for blood pressure. And what else would be good for blood pressure? Hawthorn is very good as well. But if it's more to do with something that's in the eye itself, you need to protect eye health. So I'd recommend a herb called Eye Bright. You can buy it either as a tincture, or I think Dr. Vogel do a tincture, but you can also get a Viridian Eye Bright with blueberry in there, and that's great for the health of the eye. And I'd also recommend the omega-7 fats, which come from sea buckthorn. And this is great for anything dry. So any mucous membrane that's not working, so if your mouth is dry, if your eyes are dry, if your skin is very dry, the omega-7s are amazing. And if the fats get into the tissue of your eye, that can often solve a floater problem. But it does take time, so I'd say be patient. You probably need to give it 4 to 5 months before you'll notice the benefit.
Okay, a mum of a 14-year-old teenage daughter gets very heavy periods, but it's the cramping for the first 2 days that she's having huge problems with. She can end up being out of school. The cramps are so bad. What would you recommend?
Okay, and it's actually quite common, Patricia. I've seen more and more of it than, I can't remember much of it from my own youth, people complaining, but I see a lot of it in the shop now. And I definitely know that from COVID and the COVID vaccines as well seem to affect younger women's cycles. So we've had a lot of experience trying different things. So, a couple of things I would mention. So the first thing is really, I suppose, for the pain and the cramping, magnesium is great. And you need quite a high dose of it. So the best one, I think, is the Viridian blend, because you get 300 milligrams per capsule, and it's not a good, nice, strong one. So you'd probably want to start that at least 7 days before the period is due. And that can be really good for cramping. The other thing as well is that a lot of the time cramping is due to the heaviness and the clottiness of the blood. So taking the fish oils, like the omega-3 fish oils, all the time, have two benefits. First of all, they're great natural anti-inflammatories, so they could help with the pain in a roundabout way. But secondly, they're fabulous for blood thinning. So they will definitely help with the heaviness, the clotty blood, and also that's probably what's causing the pain, linked to the pain. So omega-3 fish oils. And then the last thing that I would recommend is something called DIM. It's diindolylmethane. And it's a supplement that really helps your body to detoxify estrogen. So when people have very heavy, painful, crampy, clotty periods, we say that they're more than likely estrogen dominant. So helping the body to clear estrogen is key, and the DIM is fantastic for that. And you can get all of these in one product by a company called Nutri-Advanced, and it's called Fem Balance, and that's the one that we get the best feedback on across the board. Okay,
well done. Hi, Anneliese. What would you recommend to reduce facial hair? I'm assuming in a female.
Yeah, so there's nothing to reduce it once you have it, Patricia. So generally it can be linked to a couple of things. Increased testosterone. It can be linked with weight around the middle. Like menopause is a shocking one. We all seem to sprout beards around after menopause. And also can be linked to polycystic ovaries. So really you have to kind of try and identify where is the problem. It's generally an imbalance of hormones. So as a female, we have too much androgen, which is kind of testosterone, male-type hormones. And that can be due to a hormone imbalance. Saw palmetto can work sometimes, but it's generally not as simple as that. And once you have the hair, there's nothing you can do. You have to just have it dealt with. So I'd recommend, I think laser is the best way to do that. If you're dark, I can't think it's no good if you're fair. But an electrolysis, and that will get rid of the hair follicle for good then, so it'll be gone for long term.
Okay, very, very funny, and I don't even know how you answer this one, but Angela's been on saying Happy New Year to you too, Angela. And Angela's husband is overweight. What are the best tips to motivate him to slim down? He has achieved it in the past. But unfortunately the weight has all gone back up again. It's hard to motivate somebody. They need to want to lose it themselves, don't they?
I'm shocking myself. You know, if I've signed up for so many exercise apps on my phone and I haven't done one of them. So I need to go to a class. Yeah. You know, for me, that's the only way. So I think in this case here, really book somebody in for a weight loss program. Like I have to say, I think sometimes Slimming World and Weight Watchers are fab because there is such a lovely community, we're all in it together feel about it. And actually the diets are fairly healthy. So that can be a great motivator. Or book him in with a weight loss coach would be another option, and book the first appointment so that he goes. And then that way he'll probably get motivated himself then at that stage. But it can be very, very hard, especially this time of the year. We're all a bit depressed, so we'd like some comfort eat. And the other tip I would say is that for his wife, do not have anything in the house that you don't want him to eat.
Yeah.
So that's it. Like we spoke about this last week, Patricia, I got rid of all my junk out of the house because I just couldn't stop. So just don't buy these things. Don't have
them in the house.
Yeah, don't have them.
And maybe motivate him, go out for a walk with him, encourage him to take exercise, but do it with him.
It is. is, but unfortunately I had this conversation with himself this morning. Exercise really doesn't do it. Like I did nearly a 12k walk yesterday and I burned 350 calories. So you definitely need to cut your food, unfortunately.
less in the mouth. Okay, listen, have a lovely week. And we'll chat to you next week. That is Anneliese Russell of the Health Hub, Times Square in Ballincollig. You can check out her website, healthhubstore.com, where everything we've recommended today she'll put up online this afternoon as heard on the radio.